Thank you, Kelvin. It's a pleasure to be here, and looking forward to talking to you all today about artificial intelligence, the impacts in healthcare, as well as something that we refer to as structural transformation. As we get into this, just a couple quick disclosures. I have several board and advisory roles at various committees. CivicaRx and CivicaScript, which we'll talk about later today, are two nonprofit companies. I'm on the board of Yale School of Public Health, Intermountain Ventures, the board of Intermountain Ventures, and an advisory board member of Menlo Ventures Healthcare. Just want to get that right out up front. We're going to start with a brief 30 seconds of a recent podcast before we jump in to our topics about artificial intelligence.
You ever feel like we're living in a bit of a paradox when it comes to healthcare in the US?
Paradox?
Yeah, like on one hand, we're talking about like groundbreaking new treatments, cutting edge technology, all that. But then we also keep hearing these stories about people having to ration their essential medicines because of the cost. And it's just heartbreaking.
Yeah, no, it's a huge challenge, I think, trying to balance that incredible innovation that we see with making sure healthcare is actually affordable for everyone. And
now, what might surprise you is that wasn't a podcast at all. That entire thing was generated by artificial intelligence. Okay, so my collaborators loaded my doctoral dissertation from Cambridge into an application called Notebook LM, and within 3 minutes, we generated a 15-minute podcast, interactive like that, interrupting each other, laughing at their own jokes. And guess what? They nailed the content. They distilled down 180-page technical dissertation work that took 4 years to develop in 3 minutes. When we first started this, I actually sent this to my communications teams and said, hey, we just did this podcast, check it out. And they're like, that was awesome. Hey, who are the voice actors? We want to, let's talk to them. Which is when I did the grand reveal of the whole thing was generated by AI. Now, this is not going to be new, like in a few weeks from now. Some of you might just say, that's not even new now. Welcome to the pace that we are at. We're going to talk about the pace of change and how speed plays in. We're going to go through some recent survey data that came off the press just a few weeks ago, and then we're going to give you an example as we start moving along of what is something that means agentic AI, and what kind of implications do we have with this? And then at the end, we'll kind of take a step back and up about what does this mean at a national economic level for U.S. healthcare. Sound all right? All right. I love this quote by Rick Warren. When the speed of change around an organization is faster than the speed of change within the organization becomes irrelevant. I think the implication for all of us as business leaders and executives, things are moving really fast. And if we think it's business as usual, we are wrong. Now, I'm a big fan of numbers and thinking about fact patterns. So when you look at experience over the past decades of when companies reach the S&P 500, now, if a company's trading on the S&P 500, this is an indicator that they are like at the top of their respective industries. And in the 1950s, when a company finally got to this point of being publicly traded, they stayed on the S&P 500 for around 60 years. So you got there, and you stayed there for decades. Now, in 2016, that number had dropped to 24 years. Now, in some of the 2020s, and this is an old forecast, this number I'm about to show you is pre-generative AI. 15 years. Okay, so we're having a quartering of what it meant once you become a large, predominant company and how long you maintain that position because of the rapid increase in the disruptive cycle of innovation competing against you. Main point here, things don't just feel faster. They are faster. And we have to change. We have some major headwinds in healthcare. Okay? Aging population, we have huge needs for greater productivity. Workforce shortages, the standard model today is not working. Okay? So I work at Intermountain Health. If Intermountain hired every single graduating physician in our entire footprint, we would still be thousands of physicians short compared to meeting the demand that is surging, that is happening when we think about an aging population. In other words, we cannot do things the way we have done them, full stop. Also, the barriers to creating new innovations. So when you look at how much does it cost to create like a new drug, a new therapeutic, the Tufts Center for Drug Development out of Boston pegs, last time I saw this number, it was around $2.6 billion to create a new drug. Now, that's also a couple years old. I wouldn't be surprised if the next time that they produce the report, it's well north of $3 billion. We have what we would deem as market failures. There's sometimes where the markets don't always react the way that we think. We have instances not about the new drugs, but the old drugs. At any one given time in the United States, we have 250 plus generic drugs that are on active shortage that we can't get because the companies are not able to attract sufficient capital. We have things that have gone overseas. We have concentrated it so much where you have one or two companies that produces, 25 to 50% of the world's supply. And then when a natural disaster happens or a regulatory shutdown, the whole world can't get access. We have some things we have to address. And a big part of some of these things will be technological advancement with artificial intelligence. So when you think of, this is from a report that was put out literally just a few weeks ago, last month, by Menlo Ventures. So Menlo Ventures is like a real high-end venture capital firm in the Bay Area. They backed some of the early companies like Uber and several others. They're big time in the artificial intelligence space. And so they've interviewed around 700 executives, and their focus was what is going from pilot to production and what is actually not just hype, but what's actually getting converted and being used as commercial-grade software in the healthcare industry. So I'll show some graphics here, and then I have a QR code. If you want to, you can go straight to the report and get way more detail than you would need. Doesn't cost anything. It's free. So what was super interesting about one of the findings in this is that actually healthcare, as it relates to commercial-grade purchasing software, is actually adopting artificial intelligence faster than the general economy. Now, I will tell you, having spent a lot of time working in healthcare, this surprised me. This really surprised me because of how complex the healthcare environment is, how regulated the healthcare environment is. But in aggregate, these healthcare providers adopted it faster than the rest of this general economy. Health systems been adopting it fastest in this segment that they looked at, followed by some other outpatient settings, payers a little bit farther behind. But anyways, rapid increase in adoption. Now, what in the current state are they using? When you look at where the spend is going, a biggest portion is within ambient scribes. So these things would be like Microsoft Nuance, et cetera. And a big part of this is because the overall cognitive and administrative burden associated with documentation that is crushing our already strained and scarce workforce. So when you actually have these organizations that are like, we actually have technologies that can help automate and synthesize all this complex information that you would normally have to type in, it's like hard to even keep up. It's like we have comments from physicians about how like they feel like they're getting their life back. You know, in the industry they talk about, like pajama time, where like once you get done and you actually have to log in and do all the documentation. it's kind of crushing at times. Huge adoption in that area. Not surprisingly enough, where the money flows is the second biggest area. Okay? Coding, billing, edits, complex. You know, like as a statistic, I'm pretty sure Walmart sells like 28-something thousand products, okay? And Costco sells like in the 2,000, like a tenth of that. It'd be very common in like a large health system to have somewhere of like 80,000 or 100,000 services. 3 to 4x what Walmart sells. So when you talk about the complexity of coding and billing, all these types of things, it's going to be there, and that's not just for hospitals. I mean, obviously, in the life sciences space, all the complexity that's managed, wow, it's breathtaking. When you look at some of the other areas that are getting traction, smaller dollars today, but massive uptake. Patient engagement, 20x change in the last year alone. Same thing with authorizations and payer kind of functions. Things are moving. So as a futurist, you have to kind of try to discern what is a trend and what is a fad. And when it comes to artificial intelligence, all of us that have really been focusing on this really deeply, like this is not fad. In fact, one of the craziest things is when you think about right now, today, AI is the cruddiest it will ever be. It's only going to get better. So let's just quickly do a quick little like lexicon on terms around artificial intelligence. So depending on where you look, there could be different categorizations. I like things simple. The more simple you can make it, the more you can use it. So when you think about basic artificial intelligence, like performing a narrow task, think about how many times you use Siri on your phone to say, hey Siri, set a timer for X minutes. It's clear, it's defined, it's basic. That's a basic AI type of function. When you think about predictive artificial intelligence, think of like when you're watching Netflix or YouTube, and you get to the point where it starts to feed things, hey, you would probably like this. Changes the thumbnails on the front of whatever you're picking to increase the likelihood that you might click on it. That uses data to nudge you and make predictions of ways to engage you in the process. That's predictive artificial intelligence. Now, more recently, we've gotten into generative AI. Obviously, ChatGPT being probably at this point the most notable, but not the only player by far. In this case, it's not just about directing you to something or using an algorithm, it's actually creating content. It's creating podcasts, it's creating images, it's creating job descriptions, marketing plans. It's creating things that, honestly, your typical human can't do always, or not do as fast. And then we are vastly getting into, very quickly, agentic AI, which is not just about reacting to a series of always user-initiated prompts, but it's actually learning from the interactions around it, taking actions independent from a single prompter, and actually driving activity as an agent in and of itself. Agentic AI. Let me give a simple example of this agentic AI. So there's a company called WiseCare AI, still small at this point, founded by Dr. Gokhan Matan and his wife Demet Matan. Dr. Matan is on MedPAC nationally and really is focused on how we think about the national insurance system and reforms there. And what you can do with this is independent of any type of insurance broker. It will guide you autonomously through the selection of choosing a insurance plan. In this case, they're initially focused on Medicare Advantage, where it'll ask you if you're on any medications. It will ask you who your doctor is. We can think about networks and panels. And ultimately, it will go out, it will look at benefit schedules, formularies, it will go directly to government websites talking about cost sharing, all these types of things, and it will basically guide you through, just like a broker would, how to select the best insurance product for you. Now, I don't know about you, but like insurance product selection has always been crazy complicated, even for people that work in healthcare. Not to say that this is the best solution, just to give you an example, that this exists. And there's numerous other things that are really changing faster than this. So when you think about it, when you look at the one number, there's all these projections out there about how fast this is moving and what do we think we're going to see. There's one number that you could validate within a Microsoft report that said by 2028, there's an expectation to have north of 1 billion, with a B, 1 billion artificial intelligence agents by 28. So let me just anchor this for a second. In the future economy, both in and outside of healthcare, the number of digital workers will far outstrip the number of human workers. I'm going to say that again. Over the next 5 to 10 years, just think about it, over the next decade, the number of workers will be digital, will far be larger than the number of people doing this work. If you're looking for a term to do a little bit more research on this, the concept is called a frontier firm, and that term is industry agnostic. A frontier firm is the concept of integrating digital agents and type of work into a human overseen model, so that it starts with, pretty soon, every person will have an AI assistant of sorts. Over time, you will have a person and a team of agents. Long term, you will actually have a majority of AI-operated functions that integrate together, just like corporate functions do today. IT, HR, functional experts, etc., that will be agents that will interact so that it will be AI-operated and human-led, human-guided. But it will be different, and it will scale very differently than today. Now, if we just step back for a second, okay, and we talk about AI and we talk about the U.S. healthcare system. One of the hallmarks of U.S. healthcare is its ability to produce novel scientific innovations. And I can think of no group that really embodies that aspiration and that reality, really, more than this group within BioUtah. You know, you're the innovators, you're the entrepreneurs, you're pushing the boundaries of what's scientifically and technically possible. That is a hallmark positive aspect of what's working well in U.S. healthcare. What's not working great is the fiscal sustainability. We got a lot of new stuff, but it's crazy expensive. And we've got to somehow figure out how to do that in a different way. Now, I'm an innovator at my core, and I love when we can have markets and competition drive innovation and affordability. And so besides the technology, the one other aspect that we believe will take root, and is starting to take root now, is we don't just need new technologies, but we actually need new types of businesses, fundamentally structured in new ways. I'll give an example. So first, when you think about many times when you're trying to create a breakthrough innovation, we think about venture capital. We think about how do we actually capitally allocate to the best ideas that have the likelihood of breaking through. Use equity as a model. Oftentimes has an exit associated with it, and it really is about creating new things. This is a hallmark of American healthcare. We also believe, though, when we try to get to some of this more democratization or affordability, there's many times when that approach is viewed at almost solely from a policy perspective. We actually think there's a way that we can use the market to create things that are new and also make things affordable that are old. In this case, instead of focusing on the things that are brand new from a product or service perspective, you focus on products that are old, off patent, standard of care, a long time. Instead of focusing on an exit, the businesses can be structured that they're focused more on an annuity. So think of this as like stocks and bonds in the market, and equity-backed and different debt-backed companies to do this. And it really, the focus here is not about new products. The focus is about aligning a structure behind a product that is needed as an essential product. And you're like, I'm going to try to make this a little bit more concrete. For example, several years ago, I'm talking left to right. Several of my partners and I, we co-founded a business, by the way, that nobody owns. It's a nonprofit, called Civica RX. This was focused on drugs that were simply on shortage, like perpetually. These are like old drugs. This isn't like the cure for cancer. This is like daptomycin, vancomycin, anti-infectives. And we were dealing with this issue, and we couldn't raise money because it was a commodity product. And what we said is, could we structure a business that actually could create an intentional commodity? Like, let's create a commodity on purpose. Now, as a former chief strategy officer, that was like really twisting my brain up. I was like, you're always trying to be different. You're always supposed to be differentiated. And we're like, we should make this thing pure vanilla. Like the most commodity thing we could ever do. Well, guess what? It worked. We've aggregated now over 1,500 hospitals, focused on 80 different medications, have treated over 90 million patients, and improved access sustainably over 10%. And in some cases, on certain drugs, over 40%. And guess what? We didn't harm the aggregate ability for new innovators to make new stuff. The main point about this second section about structural innovation that I hope people take away is sometimes we need a scalpel and not a sledgehammer. Some of the things that, from an innovator's perspective, that make me the most nervous is if we get a blanket draconian policy that puts a wet blanket on innovators like you. Because we need more innovation, not less. But once that product innovation has largely, it's yielded what it's needed to do and it's no longer new, how do we get it to everybody else? That's a question that we're trying to solve. Another example. Once we did this, we got approached by a bunch of insurance companies. 23 insurance companies that covered over 100 million people approached us and said, you know what? Like, we know this is a kind of a boutique structure, but we think it could really help with a couple areas of some really, really high-cost medications that are no longer patented. We started looking at it, and in the end, we agreed. We actually formed up another company, Civica Script. The data that's presented here was published this summer in the New England Journal of Medicine, Catalyst, and we showed that we could actually sustainably reduce and sell a high-cost cancer drug that used to be high-cost, was abiraterone, it was a cancer drug, to treat metastatic prostate cancer, and it was selling in the market for $3,000 a month. We sell it for less than $200. Okay? When we published this paper, within 48 hours, I received a call from the U.S. Joint Economic Council in Washington, D.C. This is like the economic advisory firm of the U.S. federal government. And they said, how did you guys do this? And we explained how it worked. We talked them through everything. And what they said was really important. They said, so you found a way to use the market to help address things on the affordability end on the back, but not hurting the front-end innovators. And we're like, that's the goal. The goal is we have to preserve the ability to do novel innovation and, at the same time, on the back end, make things affordable. In the next several weeks, we are actually going to be coming out public with an institute that we're launching that is focused on this back-end structural innovation called the Mindshare Institute. The purpose of this is about solving market failures that are hurting people. Now, I remember the first time we talked about this, and they're like, you really want to have like the term hurting people in your purpose statement? And we're like, well, yes, we do. Because we have to call it what's happening. We need innovators. We also need a way to democratize these things on the back end. Overall, by focusing, and when we have these new technologies, etc., and these new structures, well north. This 100 billion plus opportunity moniker is related to the structural aspect of healthcare improvement, even with focused areas. As it relates to artificial intelligence, those numbers will far exceed this in terms of how they're adopted across the board. If I get down to a few last things. When you think about innovation, new technologies like artificial intelligence are going to dramatically reshape the world. If you do not have an AI assistant today, you are behind. If you are drafting your own agendas the old school way, you are behind. You need to create this ability for you to facilitate a lot of this digital work. And it's going to challenge things like intellectual property. What does it mean when you hire someone and they bring all their bots and you're like, my bots come with me? We literally have artificial intelligence that created its own avatar and got hired by a company in hyperscale and figured how to get itself paid. Okay? They found it eventually because it didn't have the ability to set up a bank account. Things are changing. At the same time, we also need to look at structures, new types of businesses that enable this technological advancement to push the boundaries while at the same time following behind and making sure that people aren't left out. Together, they can bring entirely new possibilities. And my last thing, and this almost like charge, I would say, is embrace it. Embrace it, because it's here and it's coming. Lastly, thank you for your things that you do. The innovations that you make possible, the late nights, the grind, the figuring out how to get that next round of financing, figure out how to get that next prototype out the door, from one innovator to another, for someone who's had family members that have massive challenges. Thank you for making life science the science of life. Thank you very much.